Thursday of a new month, and that means it is time for Medical Minutes presented by Lake Cumberland Regional Hospital. And it's so good to have calling in this morning Dr. Jennifer Smith. She is a diagnostic radiologist. Good morning, Dr. Smith.
Good morning. I need to kiss a wrestler, apparently.
Yes, after the show, maybe you can take care of that. It's so good to have you on the show. And Dr. Smith, we are honoring October being Breast Cancer Awareness Month. And that's what you do in your practice, is try to prevent breast cancer and help those patients going through that journey. So, Dr. Smith, when we talk about breast cancer, we primarily focus on women, but men can also get breast cancer. Is that right?
Yes, that is correct. Men do get breast cancer. They get it about a rate of 100. So, for example, a woman's lifetime risk, an average woman of getting breast cancer, about 1 in 8 people. But then you're talking about a much lower risk, about 1 in 1,000 people lifetime risk of breast cancer.
Yes. And when it comes to breast cancer, when should people begin talking to their doctor, talking to you about getting screened for breast cancer before symptoms start to come?
Well, most people advocate, most literature now advocates beginning very early with discussions about breast cancer risk. For the average population, a woman of average risk, generally the recommendation is to start annual screening at 40 years old with mammograms. Mm-hmm. People with certain types of risk, increased risk, which is mostly going to come through family history or inherited genes, they may even want them to start as early as 25 or 30 with yearly mammograms and breast MRIs. What we have to remember, what we're trying to do, I think is what you said, is screening is early detection. We're trying to find cancers when they're smaller, when they haven't gotten outside the breast, when we're still able to fully treat them. But the one thing I think that women also need to remember is that only about 15 to 20% of breast cancers are inherited or related to genes, and so every woman has to be worrying about their risk. The other really important thing I think we need to make clear to women in October of 2023, Breast Cancer Awareness Month, the one thing that saves women's lives, without a doubt, more than anything, is screening mammograms. Mm-hmm. That is mortality from breast cancer, and that's why we need people to come in and get their mammograms.
Now, when you talk about a mammogram, are you talking about just a doctor filling the breast, or are you talking about an actual ultrasound? Is that the best way?
A mammogram is an X-ray picture of your breast. Mm-hmm. So you come in and you get compressed. It's different than an ultrasound. So I'm talking about the X-ray pictures we take of your breast called a traditional mammogram, and that's usually they take at least 4 views, 2 views of each breast. Mm-hmm. Now more and more, we're moving, most institutions, certainly here at Lake Cumberland, are moving towards the 3 mammograms, and that is a wonderful tool. It's been shown to be of significant use, potentially in screening with dense breast, and it also is shown to detect smaller, earlier cancers, and also one of the most important things is to cut down on unnecessary callbacks, unnecessary returns for repeat imaging, and unnecessary biopsies.
So there is a difference between an ultrasound and a mammogram, right?
Oh, yes, ma'am. A mammogram is a picture taken with, X-ray pictures. That's, if women think of when they get their breast kind of compressed into a machine, that's a mammogram. An ultrasound is, we use radio frequency waves, and a technologist runs a probe over your breast. Ultrasound, in terms of screening, is of somewhat limited utility. There's been a lot of discussion about dense breast and what's the best to do with dense breast. And ultrasound was thought to be something that might help with screening for dense breast. But literally, I actually read an article just recently called Breast Density in Your Mammogram, and there is no consensus. Literally, there's no expert consensus about what exactly women with dense breasts are supposed to do additionally. Mm-hmm. There was a thought for a while that ultrasound would be useful, even MRI, but there are big issues with those 2 tests unfortunately, they can't discriminate always what's cancer versus what's not cancer. You see a lot more things, and women sometimes have to get a lot more unnecessary breast biopsies.
Yes.
So I'm sorry, go ahead.
No, I was just saying a lot of women have some anxiety sometimes about going for the screenings because you're always afraid that the worst will be found, but that's not always the case. Sometimes it's good just to have a peace of mind that you're okay, and I know what was told to me sometimes when you have your first mammogram, the doctor might ask you to come back, but that doesn't mean there is anything wrong. The doctor's just getting familiar with what your breast is supposed to look like. Is that right?
That's 100% the truth. And that's why it's so important for women to keep up regular mammograms. Because if you have a change in your breast, like you said at the beginning, we may look at it, we may not sort it out, but as your breast continues to mature and evolve, we can follow that in mammograms and not have to do unnecessary tests, not have to do unnecessary callbacks. So we basically estimate about 1 in 10 women that get a mammogram will probably get called back. So these are sort of vague statistics. And we're talking about, 1/6 to 1/10 of those people that get called back. So you're still talking about, in the 10% range, will actually end up having a finding that is related to cancer or precancerous stage. Even the majority of the biopsies we do end up being benign. The thing about breast cancer is there's a lot of gray and there's very little black and white. So when we see findings, we generally tend to be aggressive about biopsying them. And the main reason for that is that if we find early breast cancer in a woman, we can save her life. So we end up doing a lot of people, like you said, like your doctor told you, if there's anything even questionable, we're going to call you back. We're going to take repeat images of it. But again, the chance of that ending up being a breast cancer is, still less than 1 in 10.
And what about pain when it comes to having a mammogram? Again, some women can be concerned that it's going to hurt. Is that the case?
Mammograms can be uncomfortable for people, especially people with smaller breasts. However, we've got new comfort technology in our mammogram hardware at Lake Cumberland, and more institutions are getting it. So they're designing paddles and designing compression, and they're tailoring all of the new technology to make mammograms more and more comfortable and less painful. Generally, they're not excruciating, but they can be uncomfortable. But with the new technology, we're finding women are finding mammograms more and more comfortable. We're having fewer and fewer complaints because the companies are actually designing the technology, which is brilliant, to be more comfortable for women. So I would say if a woman had an uncomfortable mammogram years ago and that's made her resist wanting to come back, I would suggest she try to come back again because I bet she has a new and much better experience today.
Yes, and Dr. Smith, you've talked about this a little, but if someone does come in for a mammogram with you and you do find what is potential cancer, what are next steps from there? What do you do for the patient?
Well, it depends on where we find the finding of concern. We may do a biopsy using an ultrasound, if that's the best way to get it, or we can do a biopsy with the patient in mammogram pictures. So that would be the next step, is always going to be a biopsy. If that biopsy comes back as positive, there is, at Lake Cumberland in many places, automatically a patient gets matched up with someone we call a breast navigator. And that's going to be someone that's going to be with them watching their process from start to finish, making sure that no balls get dropped, that all the questions are answered. Because once you get started, if you do have a diagnosis, then you're immediately going to end up having a bunch of new doctors. You're going to have probably a breast surgeon and an oncologist and maybe even a radiation oncology doctor. But I would say one of the most important things is getting hooked up right away into a system with what we call is like a breast navigator. And you can almost think of that as like your fairy godmother helping you to walk through the steps and making sure that everything gets taken care of and answering all your questions.
That's great that you all provide a team of people to help people. That can be a scary word sometimes to hear, that you all help them through that. So let's talk about signs and symptoms, Dr. Smith, that people need to pay attention to when it comes to breast cancer.
Well, I would say the biggest thing women should get imprinted in their minds is any change. So any change in the appearance or the feeling of your breast, the areas under your underarm and around your nipple area. So we look for anything that is like a knot or a palpable lump, something you can feel. Any changes, meaning you feel like the tissue on the outside puckers up, even the skin looks different. That's important. A certain area where there's pain that stays in one place all the time and doesn't go away. Also things like any flakiness, scaliness, or itchiness of the nipples, nipple discharge. But the biggest thing I think for women to keep in their mind, because we do know our own breasts, just from taking a shower, even if we're not doing self-exams, anything that is different or new. That's really what we need to look for. Anything that is different or new, particularly if it's only on one side.
And those, you mentioned self-exams, those are important because that can be how you can first detect something is different, right?
Exactly. That's the earliest time you might be able to find something that you might not have found otherwise, because you're going to relax and actually paying attention to your breast.
And Dr. Smith, do people need to be referred to come to you, women referred, or can they call your office directly and make an appointment to get that first screening that is so important, and to have you take a look at them?
Generally, women just need to have an order from their doctor, from any doctor. In some places, we used to do things, without having any doctor orders, and that has created its own problems. But all a woman needs is an order from her care provider, any care provider that she has. It can be her OBGYN, it could be her regular doctor, it could be her cardiologist. She just needs an order from a doctor saying that she's mammogram.
And Dr. Smith, with October being Breast Cancer Awareness Month, this would be the perfect month for women to get that first screening for breast cancer and to talk to their doctor about it. So what would you say to women who might be just a little hesitant because they don't necessarily think anything is wrong? They're not seeing those signs and symptoms that you mentioned, that they might think they don't need to go right now. What would you say to those women?
I would kind of repeat what I said first off, and that is that the majority of breast cancers don't have any family history. Because a lot of times I know women will think, well, there's no breast cancer in my family. I don't know anyone that has it. I don't want to deal with this. But only about 15 to 20% of breast cancers are going to have any association with risk factors, genes, or family history. So the vast majority of women that get breast cancer, there's nothing that they can look at to say, oh, I was at risk for this. The other thing I would say to them is 1 in 8 women that's the risk of any woman on this planet having breast cancer in her lifetime. 1 in 8.
And
so that's a lot.
1 in 8 women, right?
1 in 8 women in their lifetime have so if you take all women and look at their lifetimes, 1 in 8 women of those women will have breast cancer in their lifetime.
Can you talk, Dr. Smith, for just a moment before we let you go about this genetic testing? You did mention that a lot of women who can get breast cancer for the first time have no family history, but does this genetic testing maybe help you know what kinds of cancers you might be more apt to potentially get because of your family history? Should people think about that genetic testing?
Absolutely, they should think about genetic testing, and that's one of the things that should change breast cancer management for women. Women who have any of the increased risk cancers, particularly the people hear a lot about BRCA1 and 2 genes, they will have up to a 60% lifetime risk of getting cancer. So this is why it's important for women to start having discussions early with their healthcare providers. If they have things in their history, strong family history, women with breast cancer early in their lives, other cancers, they may absolutely need to have genetic testing to make sure they don't have one of the cancer genes. And that is just being done more and more and more because we're finding, and I would say this all goes along with it. What's really wonderful in breast cancer right now is we're able to separate cancers. We're able to do all these molecular and genetic testing, and that way we can devise and arrange things that are perfectly treated for that person's cancer, their risk factors, and everything. We just have so many more options. But absolutely, if you are concerned, you have people in your family with breast cancer, have a discussion with your care providers because they will get you hooked up with the genetic systems, with genetic counselors, and get you very important tests that can literally save your life and save lives of people in your family.
And one of our last points of conversation that we always have with the doctors when you all call in for Medical Minutes is just to talk about the importance of women having a primary care physician that they see on a regular basis, that they get those tests, blood work, screens that they need. How important is that primary care physician?
It is absolutely so imperative and so important as we get older. It's hard to keep up as an individual with the things that are recommended to be taken care of and to be done during your lifetime. But these are all things like breast cancer screening that are designed to save your life, to keep you healthier and happier for a longer period of time and around for your loved ones. You have to have, for me personally, you must have that essential person who is a coordinator. It's too hard for anyone to, if a man or a woman said, here, take care of your car, I know what to do with it, get it fixed, I wouldn't know what to do. I asked a professional to help me with that.
Yes.
And I would say it's absolute essential for anybody today in healthcare. Have that primary care physician, have them know your risks, have them know your family history, have them know all about you and able to and let them help to coordinate these things that need to happen, like mammograms, which can save and does save many women's lives every year.
And Dr. Smith, you are with Lake Cumberland Regional Hospital. Where is your office located? Where can people find you? If they can call your office, get in touch with you if they have questions, want to make an appointment. I know you did say some need to be referred from their doctor, but what is the best way people can get to know you and come see you?
The best way to get to know me and come see me, I would love to see them, is I work through the Lake Cumberland Regional Hospital Network, and we do a lot of our imaging, particularly breast imaging, at the Imaging Center, which is just back behind the hospital on Carroll Circle Road. And all they need to do is call, make an appointment, and come on in to see us. We provide, at Lake Cumberland, comprehensive breast cancer therapy, comprehensive screening. We do MRI, ultrasound, mammogram, and we have breast cancer, we have surgery, we have radiation oncology, and we have oncology. Basically, that's become the wave of the future. We are a regional hospital that provides all breast cancer services. And that's what's so exciting, I think, for rural America and places like is that you don't have to go to Louisville. You can do everything right here with experts all trained and specializing in these fields. So come see us at Lake Cumberland Regional Hospital, and come see us at the Imaging Center, which is right next to the hospital. Call in anytime. We would love to see you, and we would love to take care of you. We want to save your life. We want to help.
Yes, and it's so good. Like you said, people can do that right here in Somerset and Lake Cumberland and Pulaski County. They don't have to leave to get that kind of care with you and with Lake Cumberland Regional Hospital. Dr. Smith, thank you so much for calling in. It's only October 5th, so women, you've got October. Please consider getting those screenings, talking to Dr. Smith during Breast Cancer Awareness Month. Dr. Smith, so good to talk to you.
Thank you so much. Lovely to talk to you. Have a wonderful day.
You too. That was Dr. Jennifer Smith. She is a diagnostic radiologist with Lake Cumberland Regional Hospital. And please reach out to her if you've never had a breast cancer screening. Talk to her. Take care of yourself this month, October Breast Cancer Awareness Month. It is 8:47.